Hi, this is David Schaefer, the American Retirement Advisor. This segment is on how to choose a Medicare plan. Let's begin with the basics. Original Medicare is made up of two parts. Part A is hospital care, and Part B is medical services. When it comes to selecting a Medicare plan, there's actually only 5 choices. Original Medicare Parts A and B are the foundation for all of your choices. Now, some people just have A and B of Medicare, but that's not very common. The next choice would be group health insurance. Group health insurance comes in 2 types, employee and retiree group health insurance. As an employee, you do not need your A or your B of Medicare. As a retiree group participant, you're going to need both your A and B of Medicare in just about every circumstance. The next option is a Medicare supplement. These are known as Medigap policies. With Medigap policies, Medicare is your insurance, and the Medigap plan will pay the balance of the bill as instructed by Medicare. Your next option is Medicare Advantage. These are the all-in-one network-based programs that work very similar to your group and individual health insurance that you've had all your life. The final option is Medicaid and Medicare. This is when the state and federal government partner together for low-income Medicare beneficiaries to take care of both premiums and copays. Well, that's it. That's all 5 options. Stay tuned for more information to see which option is most beneficial to you. When considering Medicare supplements, what you may not know is in most areas, there's 40 to 50 Medicare supplement insurance companies, all selling you the exact same federally standardized Medigap policy. Doesn't matter who you buy the plan from, the benefits are 100% exactly the same. Each and every claim is processed by Medicare. After Medicare processes the claim, each company is electronically notified with who to pay and how much. That's it. That's all they do. They pay the balance of the bill as instructed by Medicare. Medicare Advantage plans are the all-in-one network-based programs. What we're showing you now is directly from Medicare's website. This is the only source where you can see every single Medicare Advantage plan in your zip code side by side. What's important to note is Medicare Advantage plans have federally standardized benefit, but the difference that you'll experience will be different copays and different networks for each of the offered plans. We like to share with folks that it's the plan that you're interested in, not the brand. What we're going to try to do for you is compare and contrast how you'll experience using the 2 different most popular programs, Medicare Supplement represented in the blue on the left and Medicare Advantage on the right. Now, we're going to talk in broad generalities, but you'll get the point as we go through the slide. With Medicare as your insurance company and a Medigap plan to pay the balance of the bill, you can visit any doctor anywhere in the United States. Now, you may have heard contrary to this comment, but here's how it works with Medicare and a federally standardized Medigap plan. Medicare has created 3 categories or classifications of medical providers. 90% of all providers in the United States participate in Medicare, so you can certainly go on the left column. 9% of doctors have decided to not participate. They're considered non-participating providers and they charge in excess of Medicare's allowable amounts, but the Medicare Supplement Plan F and G will pay those excess charges. And the last classification of medical providers are concierge physicians. They have opted out of Medicare completely. So if you have a concierge physician now and you're paying the annual fee of say $1,000 to $5,000 per year per person to have direct access to that doctor, you could certainly maintain the relationship with Medicare and a Medicare supplement. Medicare just won't offset the physician's fees. But if that doctor said you needed labs, diagnostics, or x-rays, Medicare would certainly pay for that. On the right column, with Medicare Advantage, you could visit any doctor or any hospital you wish, as long as they're in the network and your primary care doctor has made the appropriate referral for you. If you notice on the left column in blue, you'll experience no copay for any medical expense with Medicare and a federally standardized Medicare Supplement Plan F. On the right side, with Medicare Advantage, you'll have copays and coinsurance for just about every service, but many services are provided at a zero cost copay. You just need to check with the plan that you're looking at. On the left side of the columns, you'll experience no deductible for any medical service. In many areas, there will be no deductible for your Medicare Advantage plans. Take, for example, Maricopa County, Arizona, Phoenix, Scottsdale area. There are 34 plans to pick from. 31 of those plans have no medical services deductible. With Medicare as your insurance company and a federally standardized Medigap Plan F, you will not experience an out-of-pocket cost for any medical expense, so your out-of-pocket maximum would be zero on the left column. With Medicare Advantage plans, the out-of-pocket maximum is stated specifically on your policy. The federal limit to the amount of money you could be responsible for in a calendar year for medical expenses is currently $6,700. But check your plan for details. In many cases, you'll find that your out-of-pocket maximum is far less than the federal limit of $6,700. With Medicare as your insurance and the federally standardized Medigap Plan F to pay the balance of the bill, you're going to have to add a third card to your package. That third card would be a prescription drug plan called Part D. With Medicare Advantage, Part D is typically included, but again, check your plan for details. The most popular reason that people pick from the left column, Medicare plus a Medigap plan, is that you have the freedom of choice to use any doctor or any hospital, experience no copays for medical expenses, and you don't necessarily need a referral to go from one doctor to another. The most popular reasons that people select from the Medicare Advantage column is low or no monthly premium in addition to the Medicare cost. You'd pick the plan because you got to maintain your doctors by researching the networks before you selected the plan. The drug benefit is built into most plans, and simplicity of use. You just use the Medicare Advantage card for doctors, hospitals, and prescription copays. In this slide, we're going to discuss costs in general. If you notice, Part A is the same cost on both columns, zero, as long as you or your spouse that you've been married to for more than 10 years has worked 10 years in the United States and paid your taxes. Part B of Medicare, you'll also notice, is the same on both columns, but Part B is subject to your income. As long as your income is below $85,000 as an individual, or as a married couple below $170,000, you'll pay the $134 if you're new to Medicare in 2017. If your income is above those numbers, like 5% of Americans, then you'll have surcharges on top of the $134. If you notice on the left column, the Medigap Plan F is $155. That is a broad average. The premiums range in Maricopa County, Arizona, from $121 to a high of $380. Remember, 47 companies offering the exact same federally standardized plan, so the rates do vary considerably, so it's important to check your local rates. On the Medicare Advantage side, in Maricopa County, Arizona, we're very fortunate. We have 25 plans with no premium over and above the Medicare cost, but you want to check your rates in your area as well. Medicare Part D, on average, is about $35 a month on the left column, but the premiums do range from a low of $17 to a high of $115, so you want to make sure that you're selecting the plan that's most appropriate for you based on your prescription drug use and your pharmacy selection, not by the brand of the plan or your next-door neighbor's recommendation. Medicare Part D is typically included in the Medicare Advantage plans, and there's typically no additional charge for it. So if you're going to put pen to paper, on the left column, about $324 a month should take care of everything for you, plus whatever your prescription copays will be. And on the right column, about $134 a month will take care of your premiums. But remember, with the Medicare Advantage plans, you'll have copays for doctors, hospitals, and of course your prescription drugs. So you want to make sure that you do your research prior to selecting a plan. One of the secrets you may not know about Medicare supplements is they're offered by insurance companies under strict guidelines. A Medicare Supplement Plan F from one company is exactly the same as a plan offered by another company or any of the insurance carriers that offer that letter plan in your area. Remember, with a Medicare supplement, Medicare processes all of your claims, and Medicare will electronically notify your Medicare supplement company as to the balance of the bill and who to pay it. So they're a commodity, and the government standardized this commodity in 1989. Since these plans are exactly the same, you want to do your shopping. When you're considering a Medigap plan, doesn't matter who you buy your plan from, you'll experience the exact same results. If you're considering a Medicare Advantage plan, almost 31% of folks in America on Medicare have replaced their original Medicare with a network-based Medicare Advantage plan. These plans have federally standardized benefits, but your copays differ by plan. Selecting a Medicare Advantage plan may have more to do with the choice of doctors and hospitals offered by a particular plan than premium, brand name, or even the plan rating. If you're interested in additional reading material on the subject, may I suggest Medicare Made 123 Easy. It's in your local bookstore and available on Amazon.com. It's a more comprehensive look at this very same subject. For additional information online, you can always visit Medicare.gov or 123easymedicare.com. To stay up to date with all of the information that we've discussed and any changes that happen from month to month, may I suggest signing up for the American Retirement Advisor newsletter. It's free of charge and it comes to you by real mail or by email, your choice. If you're interested in Medicare supplement rates in your area, just let us know your zip code, your current age, gender, and if you smoke or not. We'll create a customized report for you, not with just one or two insurance companies, but every single insurance company offering that Medicare supplement in your zip code, and we'll get it off to you by email. If you're considering Medicare Advantage, wouldn't it be helpful for you to have a side-by-side comparison of every single Medicare Advantage plan in your zip code? If so, well, just drop us a line, and we'll be happy to get that out to you. All we'll need is your zip code for that. We hope you enjoyed our segment on how to choose a Medicare plan. For more information, just give us a ring or stop by online. Again, this is David Schaefer, the American Retirement Advisor, wishing you good health.